women embark on double mastectomy surgery to limit their chance of breast cancer reemerging. We learn more about the complications and now new treatments to combat those problems. In our continued partnership with Intermountain Medical Center, we take a closer look at life after breast cancer. From celebrity headlines to real-life decisions, actress Angelina Jolie's double mastectomy was Nancy Erick's reality. After being diagnosed with stage 4 breast cancer at the age of 40, after her first mammogram with no family history, Erick decided to take an aggressive approach.
I had a double mastectomy, and at the time it had spread far enough into 28 of the lymph nodes on the right side, so I lost all those.
And even though she beat cancer, it left a lasting mark.
When lymph nodes are taken, it can create somewhat of a roadblock for that lymphatic fluid, and so it backs up into the affected extremity.
And that meant sharp pain on Erick's right arm, where she now wears a compression sleeve. Lymphatic tissue builds up and then hardens on her arm. The only relief? Surgery.
Before the surgery, I couldn't see the knuckles in my hand. My arm was just solid. My fingers were just huge.
Dr. Robert Ferguson used this transplant procedure. Lymph nodes from one part of the body put in the affected area.
Once that tissue is transferred in the armpit area, it reconstructs the scarred and radiated tissue, replaces it, as well as transfers lymph nodes. And what it appears to be the case is that then assists the evacuation of the lymphatic fluid from that affected extremity.
And the relief was almost immediate for Erick. Simple tasks she can now once again do with her family.
I could actually hold somebody's hand. My 11-year-old, she's like, "Mom, you're actually holding my hand," because before my fingers were so swollen from all the lymph fluid and stuff that I couldn't bend the fingers.
Nancy Erick will always have lymphedema. She'll have checkups with Dr. Ferguson from time to time to check out her progress. But Dr. Ferguson says prevention is the best line of defense that may prevent other patients from such pain and surgery. If only some of the lymph nodes are removed, it decreases the chance of severe complications. Now, Nancy Erick will have her 3-month checkup with Dr. Ferguson in June. And if you'd like to learn more about lymphedema or the options for mastectomy survivors, log on to 4utah.com.